dealt with chronic pain? What have y'all seen? Who had some chronic pain patients?
I didn't have any patients, but I used to work at the pharmacy, so I've seen people that are on pain medicine and
Still caught into that victim mentality?
yes, very much so. And they're just, I don't know, they're different.
Well, it's not a good way to live on pain medication if you don't have to. Some people do okay with it, and they stay at that same level and they're okay, but pain medicine is a hard thing. So, so when people have chronic pain, it's probably better that they never go on pain medication. But some doctors will start them on it, and it's a problem. So anyway, fibromyalgia is a chronic pain syndrome. What's fibro mean? Fiber. What's myo? Muscle. What's algia? Pain. So that means it's kind of looked on as they'll have fibrous tissue in their muscle, and you'll actually see that. So that's why it's called that. You don't always see that, but sometimes you do. The statistics are 2 to 4% of the U.S. population is affected by fibromyalgia. 75% of those are female. I've dealt with a few males. More common in middle-aged females. I really don't know why, but that's what it is. Etiology is not known. What you normally see is there's some kind of something that happened in their life. It can be a trauma. I've seen a lot of people after having a car wreck go into fibromyalgia, to the cervical spine stress, hyperthyroidism, or after some type of real severe infection. Possible genetic predisposition, dysfunction of the hormone linkage system of the hypothalamus, pituitary, or adrenal glands, and then diet can affect it, sleep disorders, and psychological distress. And the reason why diet affects it is they've had such good luck treating fibromyalgia by taking people off of different things like gluten-free. It's always a good thing to try gluten-free if you have fibromyalgia. Eating clean, probably, just staying away from beef. Everybody's different. Sometimes people have to go off dairy. So some of that's an allergic type thing. Sleep disorders is very common with your fibromyalgia patients. So if they can get to a point where they can sleep again, it's amazing what it does for them. So probably the biggest thing that we do for them is we educate them. And try to get them geared into not being the victim anymore. So tell me about your mom, if you don't mind. When did she get diagnosed, and was there something that seemed to bring that on?
She probably got diagnosed within the last 10 years, but it took her about 10 years to get diagnosed.
Yeah, fibromyalgia's not been out there for a real long period of time, and they're what used to be known as the hypochondriacs. And they go get surgery after surgery because they just were trying to get fixed. And it's a sad thing because they usually won't go to a doctor because doctors don't believe them, and so they quit going. And it's just interesting to see that. Is that what your mom is?
Is that because they don't know why?
I think most doctors do not want to deal with chronic pain, and they do. How much time does the doctor spend with you?
7 minutes.
Maybe 7 minutes, right. So 7 to 10 to 15, hopefully 15 at least. But they do not have time to sit there and truly ask you about pain. So they don't really like treating chronic pain, so they try thing after thing after thing. So it takes a special doctor to treat chronic pain, in my opinion. It's not, I really do believe a lot of it's poor medical care. Anyway, go back to your mom, I'm sorry.
But yeah, it took her a long time to get diagnosed. She also has lupus as well.
Oh, yeah, that kind of goes with that.
I don't know if this is related or not, but she does have a tumor on her pituitary gland. Because I noticed that up there.
Yeah.
It's kind of crazy, so I wonder if it is linked.
Yeah, possibly. Does she deal with, on her pituitary gland?
Yeah.
Does that mess up her hormones?
No, it doesn't bother her at all. It's small, it's like really insignificant. They just leave it alone, and she gets it scanned every couple of years just to keep up with it.
That's interesting. The diagnosis is, and this is the American College of Rheumatology, and normally fibromyalgia is treated by a rheumatologist. There's tender points, and I've got a picture of it here in just a minute, but there are 18 specific tender points, 9 corresponding symmetrically on both bodies. And so you have to have 11 of those spots be tender. Widespread pain in all 4 quadrants of the body lasting at least 3 months. And then they're also looking at substance P and spinal fluid, so they'll do a spinal tap on them and see what the substance P is, which has to do with pain, the way you feel about how pain is. These are your different points. So a doctor literally will test these points and see if you're tender. They aren't just a little tender. You literally just have to barely put your hand on it and they will just shoot up. I mean, they're hypersensitive. And so you just touch that spot barely or just rub over it, and they'll tell you they're hurting all over, that they're just like, it's a hypersensitivity is the way they are. Anyway, there's your spots. See down at the knee, one at the elbow, and then the rest of them pretty much are in the cervical, that upper pec, trap, and then way up in the, under the occipital. So there they are.
Do we need to know those spots?
Pardon?
Do we need to know those spots?
No, you don't need no spots, because you'll have if you ever need to test, you won't need to test it, it'll come to you hopefully diagnosed. Substance, well, what you do need to be aware of is if they are hypersensitive in those areas, you do not want to massage that, you do not want to do any kind of trigger point stuff. You don't want to push into it. It will exacerbate their symptoms. It's the weirdest thing. So you have to be very careful how you treat them. You don't want to treat those tender spots like you normally would a trigger point in a muscle, because it'll make them sick. Substance P is a chemical responsible for the transmission of pain nerve impulses to and from the brain. And so it is thought to increase pain sensation, and so that's why they check that, and it's usually in the spinal cord tap. Serotonin is in the brain, and it's one of the neurotransmitters, and if the levels, normally they are decreased in a patient with fibromyalgia, and it has to do with how you feel and, euphoria and all that. Low levels of serotonin may increase the perception of painful stimuli, so they're looking at all this stuff, and I'm sure there's even more research going on with fibromyalgia, because you see it a lot, more than it ever has been. It's also a catch-all, by the way. If they can't find anything else, they'll tell you that you have fibromyalgia. So it's kind of nice when they came up with some specific diagnostic type things. Signs and symptoms, and this is what's crazy, is some of your people will have these. Some of your patients will be completely disabled by it. Others will be functioning and working a 40-hour week. And so it's just really hard to look at different things. They have headaches and migraines, a lot of fatigue. They'll have chest pain that doesn't have anything to do with their heart. They'll actually have heart palpitations sometimes. A lot of sweating, profuse. I still didn't say that right. Anyway, they have a lot of sweating. Sometimes their sympathetic and parasympathetic system is kind of mixed up. Poor memory. They will go into a fog and go to bed and stay for a week. And that, not all of them, but some of them do. And you see them, if something happens and they get a lot of exacerbation, then it kind of affects them mentally. In that they just, poor memory, low concentration. They have early morning stiffness, low back and neck pain, urinary and bowel symptoms. So irritable bowel syndrome is something that's kind of a common thing with them, and that's when they have the digestive things going on, that's when you need to look at their diet. Diet is very important in chronic disease. It's very important for all of us, right? But we can get away with some stuff, but it's with chronic problems, they really need to look at it. Restless leg syndrome goes with it a lot. Anxiety and depression. Because why? If you go to 5 or 6 doctors and they all tell you there's nothing wrong with you, but you're hurting really bad, it makes you depressed. You give up on hope. Dizziness. Raynaud's phenomenon. What's that? That's where their hands are very sensitive to cold. So they have to be careful because they literally can have, issues when it's cold outside. They have to wear gloves. Sometimes you'll see them wearing gloves even when it's like it is right now. Heightened sensitivity all over, symptoms aggravated by cold and wet, dry eyes and mouth, and vision problems. So all those are signs and symptoms of it. But they don't have all of them. There's just a thing. And I like this particular pain, vicious cycle, because that's what you have to kind of break, is you start working, and I think a good doctor will start working on getting them sleeping better. So you need to work in combination with whoever is actually their doctor. But if you can break in, so what are some things you might start with if they've been in bed for a week? Start with their endurance level has dropped significantly. How long does it take for you to drop your endurance level in bed? Someone your age?
2 weeks.
3 days. 3 days. Significant in 3 days. Just laying in bed for 3 days. So, but you recover quickly because you're young. But these guys, some of them aren't so young anymore. So you want to start with addressing their pain. What's some things that people can do for pain that you can teach them about? Have you learned anything about treating pain? We're not going to do modalities on them much, are we? Because that's just a quick fix and it really doesn't fix them much. So you have to find out what works for them. What about, we haven't done any kinesiotaping with you guys much because you haven't been in the pro bono lab, but that kinesiotaping works well with chronic pain. And it's something they can do themselves. So that's one. You can do all types of not massage stuff. I wouldn't do massage, but just getting them into using a heating pad again, or ice packs. A lot of them don't like ice packs. Things they can do at home that are easy, a heating pad, getting into a hot bath. You know how few people actually we've really given up a lot of relaxation because we don't take baths. How many of y'all have had a bath in the last month? Good. Most people don't. But taking baths can be very relaxing, and so that's a good thing to have them. If they have any, I treated a guy yesterday who has really chronic back pain. He's a soldier, and he has a bathtub with a jacuzzi in it, and he never uses it. So I'm trying to make him realize that he needs to do that every evening. He doesn't sleep well, so that's something. Do they have that available to them? Getting into the pool is a great way for fibromyalgia. So pool therapy is wonderful. Talking to them about their sleep habits. Should people ever sleep in a chair? The only time you should ever sleep in a recliner is if you just had shoulder surgery. Otherwise, or you can't get up by yourself because you've just had surgery and that's the only way you can get up. You can do it for a week or so, but after that you need to get flat in the bed again. Sleeping in a recliner is not good for anybody. How many people do you think sleep in recliners?
A lot.
A very large number of people sleep in recliners for all kinds of reasons, but it is not healthy because they're in this position. It affects their posture. It affects their muscles. People need to be out flat when they sleep. Your body needs that. So looking at how they sleep can really affect them. Do they have a good pillow? You guys, it pays to spend a lot of money on your pillow. A $2 pillow from Walmart is not good. So it really makes a difference if you have a good pillow. Is a lot of pillow ever good? No. Really, the less you have, the better normally you are. So you want a little bit of support underneath your neck. And so these neck pillows are good, but you don't want one too big. And you'd be surprised really what you need. Usually it's less than what you think. So those are just, I mean, I can go on forever of different things you can do to where you just have to individually talk to every patient and you have to care. So if you don't care about them getting better, don't treat them. Give them to somebody that likes treating chronic pain because it really does make a difference that you can help them that way. Some medications that they're on, antidepressants, muscle relaxants, analgesics, pain medications. Lyrica is a fairly new one out, and they've had pretty good luck with some Lyrica. Pregabalin, I don't know what that one is
Pregabalin.
actually.
It's the generic Lyrica.
It's generic Lyrica? Oh, well, I need to put that underneath there. And then injections of different things into tender muscles. They're having some pretty good luck with injections, you know, and doing it just for pain. And so that's another way. They probably need to go to a pain clinic if they're, I don't know that any fibromyalgia patient really needs to be on pain medication much. Because when you have chronic pain, you go on a pain medicine, but that doesn't mean you can't use some other kinds of pain relief type stuff. But to be on a narcotic is not good for them. It's just not good. Narcotics start to fail you. Narcotics are good for about, 4 weeks when you have a total knee. And then you need to come off of it, and they need to find some other way to help you. And I'll tell you, you're going to get some patients. I had a lady the other day come in, and she was with a doctor that we have a couple of new orthopedic surgeons in Fort Smith, and she came in from a doctor, and she had not a total shoulder. She'd had done an arthroscopy and did a rotator cuff repair. Went in there and really cleaned out a lot of bone on her shoulder. He gave her 20 pain pills. That means that's not even enough. I mean, that's one every 4 to 6 hours. So she just did it that would last her 5 days. Is that enough for a shoulder patient? No.
I think some doctors are getting scared to prescribe too much.
Well, but that's bad. So, because people in Poto have to drive to Fort Smith to pick up their prescriptions. If you have an older person, this woman lived by herself. She was in her 70s. She had this friend taking her around. And so, I mean, when you have some of the, I don't know, you just have to look at that. But I told her, I said, you need to call right now and get that prescription, and you need to go pick it up. I said, you're going to need it. She was in a lot of pain, and she was 4 days out when I saw her. So what are you going to do when your pain pills run out? You're going to have to take care of it right now. So anyway, they are getting fearful. You're right. But the sad thing is people who need them are not getting them. And those who don't need them, who are causing the problem, are still a lot of problems. If you've ever been in an ER in the evening, you know how many of those people are there to get pain medication? A large majority of them. And so I think that's getting better because they're forcing them to go into a pain management situation where they go to a pain doctor, and so they have to go there. They can't just, like a general practitioner can no longer prescribe you narcotics for very long. They can do it for a short period of time, and those things are good, but it sure makes it difficult for people who really need pain medication for a short time. Okay, subject. This is a patient that is actually a real person. I think she was about in her 50s. She had headaches and migraines that were present before she even became more debilitated. She has extreme fatigue, excessive sweating more prevalent on the head, poor memory, low concentration, early morning stiffness, low back pain, irritable bowel syndrome, restless leg syndrome, anxiety and depression, sleep disorders, heightened sensitivity to pain, symptoms aggravated by cold and wet, extremely dry eyes and mouth, and torn retina in the left eye. So she had the majority of the symptoms, and she pretty much was disabled. I think she was on disability. What's something else that you look at here that might be part of her problem at the age of 56? She's gone through menopause. So when you look at different dry eyes and just different things like that, some of that can be related to menopause. Lack of sleep, anxiety, just some of that. Okay, she's on hormones, so that's because she's done the menopause thing. She's on a thyroid dysfunction medication, Sinemet for the restless leg syndrome. Sinemet's actually a Parkinson's medication. Y'all know what restless leg syndrome is?
My 9-year-old has it. Is yours or not?
You know what? You need to check his iron level. And because he's only 9, Does it bother him? Does it keep him from sleeping?
Her dad has it, so I just figured, yeah, it does.
I would just check her iron level, and even if it's not low, I would put her on iron. I think about 95% of restless leg syndrome is an iron deficiency.
Yeah.
But that's just my opinion. But it wouldn't hurt her. I mean, unless she's, even if they're normal, I would think about doing it just to see if that helps her. But anyway, we don't know why people have it. It's not a fairly new phenomenon. It's only been around for, my mother has it with fibromyalgia. I think we've done it to us through medication, but it's a very common situation. It's what happens is their legs feel like they're crawling, and then sometimes they'll actually have not tremor but spasm in the legs. Does your little girl have that?
Kind of. She'll just like sit there and move her legs for, an hour until she falls asleep, just because if she stops moving them, and it starts bothering her.
But anyway, that is partly, restless leg syndrome is a very strange thing that people have. Then she has this for the lupus, the skin deal, then dry eye medication, and then she does take quite a bit for depression and anxiety. Would you look at the number of medications this woman is on? How many meds can you be on before it's starting to interact with each other?
Like 7.
Seven. Flexeril for muscle spasms, oxycodone and oxycodone for pain. So those are two things. The oxycodone probably, I don't know. I'm just telling you that's not good. And then over the counter, she does a stool softener and some things like that, which are probably something good.
Well, like the pain medicines usually cause you to need the stool softeners.
Yes, absolutely. So you're causing more problems. There you go, talking about interaction. That's a lot of medication. You're looking at a lot of money there. A lot of money for medications.
Yeah, I couldn't tell you all the medication my mom's on.
Yeah, my mother.
I know the Flexeril sounds familiar.
So she's on a muscle relaxant. Well, my mother used to do meds, and she kind of weaned herself off of all of them because they were causing her some issues. She never was on pain medication. But anyway, as she's gotten older, she's had some other issues. So.
I have a question about the trigger points.
Okay.
My mom was having some back pain a couple months ago, and her doctor referred her to physical therapy, and they did dry needling on her. And the first time that she went and did it, she left the clinic feeling fine, but she was driving home. She had to pull over because she got super nauseous, lightheaded, felt like she was gonna faint. She was vomiting, it made her feel like she was gonna pass out or something.
It would be something to, certainly tell the therapist about. And she probably needs someone to drive her home. I mean, if it gave her relief, then it might be worth trying again, but I would be afraid to do dry needling with the fibromyalgia.
It really freaked her out.
So she didn't go back and have it.
No, she had to call my stepdad, and he had to come pick her up and take her home, because there's
Did
no
she
way that she
report
could
back to
drive.
him what happened? Because that really probably goes with that. I'm guessing that's what happened with her.
That's what I kind of assumed, because of all her nerve issues.
Yeah, it's just those points are weird. My mother had some points that were actually in the low back, which isn't in this area, and I actually did a trigger point massage on her. This has been like 10 years ago, and she was in bed for a week after that. Not knowing at that point what I was doing, but just being aware of it now. So anyway, here's fibromyalgia. We may have to see where we're at. I believe we'll stop here and we'll go on with the other one on, we'll see, on Monday, because we have a number of diseases we have to cover. Yes?
I just had a question about that trigger point treatment you gave her. So what's the physiology of that? After that massage, after that trigger point therapy?
After I did that on her, why was she so, I have no idea.
Okay.
I don't know.
That's really strange.
Well, even the dry needling.
Yeah.
I mean, think about that, but you kind of release. I don't have any idea.
The Chinese would call it energy.
Yeah.
It's interesting, they've been doing that for a really long time.
Yeah.
I'd like to learn more about how they see it, maybe bridge the gap between
Right.
Western and theirs. It's so strange.
Well, and you know,